Hey guys, this is your host Rachel Pence. Welcome to Hemp is Hope, Not Dope series. Our sole purpose is to bring awareness and to educate the people about hemp and CBD. Our goal is to educate on how hemp and CBD benefits our bodies and to kill the myth that hemp and CBD is a drug. Our focus is to tell the people the truth. Join us every other Wednesday and bring a friend. Make sure you subscribe to our YouTube channel. Leave us a message, like, and share. Hey guys, I am so grateful that y'all tuned in with us on this wonderful Wednesday. Can y'all hear me? Hopefully you can hear me because it's saying it's a little off. Okay. I am so amazing. I'm so glad that y'all was able to tune in with us on this wonderful Wednesday. Guys, you have to find your passion and pursue your passion. And I am passionate about spreading the word about hemp. It's such a myth about hemp. It's such a myth about CBD. It's such something that grows from the ground. It's something that's so natural. And I'm going to keep talking about it, and I'm going to keep spreading the word. Why? Because it can help people. And that's all I want to do is help people and educate people. And I'm just going to continuously do that.
Again, and I want to talk a little bit today about CBD or CBD oil, cannabidiol. CBD oil can be derived from the marijuana plant, or it can be derived from the hemp plant. It does not have THC in it. THC is the ingredient that causes one to get high. So this does not have that in it. So it doesn't cause you to get high, but it is used for pain control. In many people, it can be used as a rub to help control pain. In children, it may help control seizures. It may help reduce anxiety. But today, I want to talk about the possible role of CBD in the mouth, in oral health, and specifically on your gum tissue. So there was a study using rats. But what they did was they induced gum disease or periodontal disease in these rats by using certain kinds of wires that irritate the gum tissue. And these rats were given CBD. Actually, there were two groups of rats, a control group that did not receive the CBD and the experimental group that did receive the CBD. Now, the CBD was given in the form of injection. And of course, when you brush your teeth, you're not going to be injecting CBD. They found that at the end of the trial period, the rats that had been given the CBD had much less bone destruction. They healed much faster, and their gums were much healthier relative to the rats in the control group that did not receive the CBD. So CBD, by the way, CBD is now a buzzword. You can hear it everywhere, and you're going to hear even more about it because a lot of people think it's the Holy Grail. Well, it's not the Holy Grail, but it may be helpful in certain situations, and maybe it's even helpful in the mouth. It does tend to reduce inflammation. It doesn't kill bacteria. So there are some toothpaste, some very strong toothpaste that have antibacterial agents in them. And those antibacterial agents kill most or all of the bacteria in the mouth, even the good ones. On the other hand, there are now toothpastes that have CBD incorporated in the toothpaste, and these do not destroy the good bacteria, but they enable the good bacteria to proliferate and continue to grow and minimize the harm of the bad bacteria. Also, a great role for CBD is it does reduce anxiety. And so it might be very helpful for patients to take some CBD oil, something with CBD before a dental appointment to reduce their anxiety. Of course, in our dental office, there's no anxiety because we never cause any patients any pain. But basically, if one has anxiety, it does tend to help reduce anxiety, and it's very effective for that. In a future video, I want to talk more about CBD, and specifically, I want to talk about marijuana and actually smoking marijuana, because as opposed to CBD or CBD oil, which could have a therapeutic role, I think the jury is still out a bit on it. Marijuana and the smoke actually is probably and is harmful to the gum tissue because the smoke tends to dry out the gum tissue and may reduce the blood supply to the gum tissue. So there's a big difference between smoking marijuana, which has THC typically, and CBD, which doesn't. So I'm going to talk more about these subjects, marijuana, CBD, in the future, but I just wanted to give you a glimpse of potentially what may be going on now. And I want to remind you to keep your mouth healthy, because if your mouth is healthy, I guarantee your body will be healthier. Subscribe to our YouTube channel. We'd love to hear.
All right, guys. Uh-oh. I don't know what I just did. All right, guys. Did y'all hear that? So I wasn't even looking for, we don't never talk about our teeth, ortho, and I wasn't even looking for that type of video. I was actually looking more for, I'm always talking about seizures, how, guys, I'm sorry, hold on. I think I have the music on. It is so loud in my ear right now. So hopefully y'all can hear me. Okay, so y'all know I love to educate y'all about how the hemp oils and the CBD has helped me personally with my seizures. How it cut the time on when I stutter from when I bounce back from a seizure. It cut how many seizures I've had. It cut down my pain disorder, because y'all know I have a pain disorder. I have a stomach disorder. I have several autoimmune disorders, and I just like to scream and yell because people throw slugs. People say negative things about, oh, she's taking gummies. Oh, she's taking CBD drops. But before you do that, why don't you educate yourself on what somebody is taking? He just told you, he's a doctor. He just told you that it doesn't have THC in it. It has nothing. It's not a drug at all. It doesn't have drug content in it. We have to educate ourselves so we can learn. There is every single thing that they have given me for my pain disorders, for my anxiety, for depression, for fibromyalgia, for my gastroparesis, for my seizures, every single pill that has ever been given to me, the list of side effects is crazy. It can cause kidney failure, liver failure. It can cause me to have blood pressure issues. It can cause me to have more seizures instead of less seizures. Like the pile up. We wonder why we get on these medications and now our hair is falling out. And so I'm so passionate about what I'm doing and what I'm saying, because I know firsthand that CBD and these hemp oils and these ointments is so much healthier for you, and they can help you. And so that's why I come on Wednesdays, because I really want you to just stop and listen. The reason why I bring certified doctors who went to school, who've done the research and who've done the studies, the reason why I bring them on, the reason why I show you their videos, because they're everywhere, because I know people are not looking for the videos. So I go find them for you and I'll play them for you so you can see that it's not just some common person who have some testimony to tell you. And if you Google it, there's a plethora. It's an endless list of people who've tried it and who can tell you the great results that they have and how happy they are that they decided to stop taking A and stop doing B. And I'm not telling you to stop taking your medications. I'm just asking you, I'm telling you to educate yourself. Educate yourself on the medications that you're taking, or educate yourself on what you need to be taking to feel better. What can help you feel better? When you have pain every day, taking harsh pain meds every day is not good on your body, especially not your liver. Is it the liver? I think it's the liver. Definitely not good on your liver, right? It's harsh, very harsh on your liver. So my whole point is, if you could find something that you could take that's not harmful to the body, that there's no study shown that it affects any organs in your body, it only adds value to the organs in your body. Why would you not want to replace that? When I had a toothache a few months ago, I took the drops, didn't really know if it would help or not, and I was like, ugh. it helped. I'm like, boom, I got something else my drops help with, right? So if I can take the drops versus taking something that's going to have a reverse side effect, I'm going to do the drops. And so I'm going to always show up for y'all. I'm going to always be proactive. I'm going to keep yelling and screaming to the rooftops, because you have to figure out what's your passion and talk about your passion and help people out. If yours is sex traffic, go hard on sex trafficking. If yours is the war against racism, go hard on racism. Pick a battle in this world and go hard on that battle, because there's a lot of battles in the world and you just got to pick your one. Okay. And this is one of mine. CBD, hemps, oils, organic, healthy, portion control, all that fits in the category of things that I love to do. So I don't see any more questions. Only person I seen was somebody asked if they could share this. Yes, please share. If you have a testimony, you can be on the episode. You can come be on the show and tell us your episode. If you have any questions, you can always inbox me. You can always text me. My phone number is probably everywhere in the world. You can always leave a message. You can always leave a comment underneath here. And I'm gonna go back and it's usually 2 of us on here, but y'all know it's a holiday weekend, right? And somebody's gonna always look at it, and we're gonna pay attention, and we're gonna tell you, we're gonna help you. And if we don't know the answer, we're gonna reach out and find the answer for you. We're not just gonna go make up nothing. No, but everybody who's on this podcast who talks to you, that's because they've been there, they've done it, they've looked and tried to find so many ways to help themselves, and they found out CBD helped. And so I just want to thank y'all for y'all time on this Wednesday. Make sure you make sure you subscribe to the channel, make sure you share it. And if you have any doubts about using CBD, if you're not even sure what kind of CBD, like what should I be using? What's the dosage? Reach out to me. I will help you. I got you. Y'all have a good night, and I'll see you in 2 weeks. Oh, wait, and I got a song for y'all too. Y'all like my song? Y'all know my husband is a songwriter. And so I asked him, I told him I needed some little beats to go in and out, intro and outro. That's the correct verbiage for it. So that was our intro, and here's our outro. Y'all ready? Uh-oh. Thank you for tuning in today. It would mean the world to me if you would subscribe to my show. Please share with your family and friends if you found this information useful. This show, Hemp is Hope, Not Dope, is for you. So send the questions you want answered. Until next time, y'all be safe.